Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome back to Let's Clear the Air, all things allergy, asthma, and immunology. I'm your host, Liz Edwards, and today I am joined by Dr. Paul Carter. Welcome. It's good to be back with you again.
Hi, Liz. It's great to be here. Thanks.
We are getting ready for the holidays, and that can be a challenge for those who are navigating food allergies, especially, I would say, newly diagnosed families. And so we thought we would start there today. And then we also are going to do a little review of what types of epinephrine auto-injectors are on the market, because there's, not all one size fits all. But first, I'd really like to touch upon what do you think is the biggest challenge for families, especially if they're just getting a diagnosis from you on a food allergy, and then, we have Thanksgiving in a couple of weeks.
I think it's tough with family get-togethers, especially potlucks, when people are making things and you don't really know what the ingredients are.
Mm-hmm.
So navigating that social issue about asking what is in things without feeling embarrassed about it. I think some people are a little hesitant to state that they have the food allergy and have to go through the process of figuring out what's in some of the foods. So I think that's one of the big challenges. The other one is that sometimes when we buy foods that are pre-prepared, even when it's not stated on the package that there's something in it, it can still potentially be there. So we could talk about both of those things, but starting with, I guess, the potluck kind of thing, I think the big challenge for people where they have the most dangerous food allergy is probably shellfish and nuts and peanuts. A little bit easier to figure those out. So I think people are a little bit more adept at asking those questions. Some of the little bit more minor food allergies, for at least for adults, but could be a little more severe for very young children, would be things like egg, milk, and wheat. And those hide in foods a little bit more often.
Yes. And, you're right. That potluck, and especially like if it's a potluck dessert table. I mean, I have a food allergy kiddo myself, and it's like the little hands go down the table, just grabbing at stuff. And
Sure.
that can be a huge challenge. The other thing I thought was a challenge, and you may hear this a lot, back when my parents and grandparents were younger, there was not a lot of talk about food allergies. I don't know that there were a lot of people diagnosed with food allergies. So trying to educate some of our older family members on what we're dealing with, I think, can also be a challenge.
Yeah, I think you're exactly right. In fact, sometimes people may think, well, it's not got enough in there to hurt anyone. And that may not be true for people who have a fairly significant sensitivity. A very tiny amount could still cause a very severe problem. And one of the things where people may not realize that there are hidden allergens would be in baked items that come from bakeries such as your grocery store bakery and places like that, where you might even have ordered vanilla cupcakes and don't expect anything to be in them. But they have done studies where they take samples of these types of foods and analyze them for peanut protein. And in some cases, they can find up to 1 peanut worth of protein in one cupcake. And
Wow.
for many patients, that's enough to elicit an anaphylactic reaction. So we have to be careful with items that are baked at a bakery where they could easily get contaminated with peanut or other nuts, and probably elect more often to eat desserts that are made by someone you can trust and who has truly not included nuts or peanut in the recipe.
So upon initial diagnosis, carrying an epinephrine auto-injector is a necessity. And can you explain what that is, what it does? And then we can kind of review some of the ones that are on the market.
Yeah, epinephrine is really the only thing that actually reverses an anaphylactic reaction. An anaphylaxis is when you have an allergic reaction that includes more than one organ system. So, if, for instance, you ate some walnuts and your mouth was itchy, you probably don't necessarily need to use epinephrine because you're really only having just the mouth itching and nothing else. However, were somebody to eat, for example, peanut and have mouth and throat itching, break out in hives all over, and then begin to have trouble with vomiting or nausea, or even have trouble with wheezing or shortness of breath, that would be a time when you have more than one organ system involved, and it's time to use the epinephrine and go to the emergency room. What epinephrine does is stop the reaction from continuing to get worse and allow you time to get to the emergency room for additional treatment. Sometimes you even need a second dose on the way, so it's good to always have two epinephrine injectors with you. But epinephrine is the only thing that really has been proven to prevent worsening of anaphylaxis and to actually reverse it. So it's the drug that we use. It's okay to take a Benadryl or a Zyrtec or some sort of antihistamine if we're just having simple symptoms like my skin's a little itchy or my mouth is a little itchy. But if you
Hmm.
have something more severe, you definitely have to use the epinephrine.
Now, with that, you mentioned the second dose because they come typically in 2 packs. What is your opinion about administering the second dose and when to do
Sure.
that?
The second dose usually is required when within 10 to 15 minutes you haven't had a significant improvement with the first dose,
Hmm.
or suppose you had a significant improvement, but after about 20 minutes you're still not at the emergency room and you're starting to get symptoms to return. Those would
Hmm.
be two typical times when the second dose of epinephrine would be needed in order to get you to the emergency room. In some cases, in adults, one dose of epinephrine may not quite be enough because we think of zero point 0.5 milliliters of a 1 to 1,000 dilution of epinephrine being the dose that an adult needs. However, the biggest epinephrine auto-injector only has zero point 0.3 milliliters in it. So while that may be enough most of the time, for some adults that may not be quite enough epinephrine, and they have to get the second dose a bit sooner because they're not seeing any effect from the first dose.
Is there harm in injecting it if you didn't need it?
Not really. You have some of the side effects of the epinephrine, like raising your blood pressure a bit,
Hmm.
making you feel jittery, increasing your heart rate.
Hmm.
But that would be absolutely necessary if you had an anaphylactic reaction, but would be just uncomfortable if you didn't. The only people that might be a bit cautious in those situations are people who have fairly significant cardiovascular disease. Then they may not want to be, they may be want to be a little more judicious in using the epinephrine and not just use it at the first sign of any symptoms, but maybe make sure that they have more than just a little mouth itching.
Right, right. So there are a number of options that you can prescribe for patients based on what's covered with insurance, et cetera. But could you just review basically what is available as far as the different auto injectors that would
Sure.
be helpful for folks to search up on their own?
So going back in time before we had the auto injector, we had to draw up the epinephrine, but you had a little vial and you had a needle and you had to draw the medication up out of the vial and then inject it.
Hmm.
Now that took a lot of extra time and some people weren't sure that they were drawing up the right amount, et cetera. And so the auto injectors were invented and EpiPen was basically the very first one.
Hmm.
It still exists. It's in a little bit different form than it used to be, but it's available in a dose for kids and in a dose for adults. In that particular drug, there are some copies that are generic that you could also get that require you to take the cap off and press the injector against your thigh in order to inject the medication. So we have the epinephrine in the form of EpiPen and in the form of the generic auto-injectors, and there were some branded generics for a while as well, but they all have almost the same way that they operate. Take the cap off and press it against the thigh. You'll hear a click, and then you hold it for 10 seconds to make sure the medicine is injected. Then there's another one that you use in the same manner where you take the cap off and then you press it against the thigh to inject, called AuviQ. The difference is that with AuviQ, when you take it out of the case, it begins to talk to you and talk you through the process of taking the cap off and holding it against the thigh and pressing, and it even counts down to when you can remove it from the thigh. And that's nice for people who want to be able to be sure that they have, sort of narrative instructions at the time that they get ready to do it, and aren't
Hmm.
trying to scramble to read what it says on the side of the pen if they don't remember how to do it.
Right.
So that one's kind of nice for as an injector. But then we also now have a new delivery system for epinephrine that's available in the form of a nasal spray. And it is based on the current studies, equivalent in how quickly the blood levels rise and how effective that the drug should be as the injectable sort. The nice thing is that there's less worry, and so people hesitate less to give themselves the medication because they don't have to worry about the needle.
Right.
It's also a little bit smaller and easier to carry these nasal sprays than it is to carry the auto-injector, because they're a small device and look exactly like the Narcan nasal sprays that police and first responders carry
Right.
for opioid overdoses. So you folks may have seen one of those, at least on TV, and have an idea of what this nasal spray looks like. The nasal spray is called Neffy, and we're using it in a large number of patients now because they prefer to carry something smaller, and they prefer to avoid the needle because they feel that they would hesitate when thinking about injecting themselves, which we don't want people to do because time is going to save your life.
Absolutely. I personally just got a Neffy. I love it because it's essentially the size of, a lip gloss. It goes right in the purse, but I guess, for men it's easy to carry in your pocket. It's not super bulky.
Right.
So it's a great option, but you're right. There are a lot of people who are very hesitant to deal with a needle at all, or family members that would be hesitant to do that for someone. But the nasal seems a little bit easier for everyone to tackle.
Right. There's always the question, like we addressed earlier, is this a serious enough event to use the epinephrine? And when having to think about using the needle, many people will hesitate thinking, well, maybe this will get better in a minute. And
Hmm.
instead, it just
Hmm.
continues to get worse in many cases. And they should have used the epinephrine earlier, because then they have a worse course because they didn't use epinephrine early. And we know from studies that there is a higher association of dying from anaphylaxis when epinephrine is not given quickly. So we definitely want to give it, and it's always okay to err on the side of safety. And if you aren't sure, go ahead and give it and go to the emergency room.
All great advice. Thank you so much, Dr. Carter, for giving us that tutorial today. Definitely a great refresher as we go into the holidays, and it's great to be with you as always. Thank you.
Thank you very much.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.